Hey there, it's Dr. Justin. It's a fabulous Friday down here in Austin, Texas. We're doing a little live Q&A. I'm here on Facebook and YouTube. So I'm going to let some questions dig in. I got a few in the queue, and we'll hit them up. Hope everyone's having a great Friday. Ooh, got a little reverb here. Hold on. All right, that's good. We knocked that out. All right, awesome. So first question here is, if you have too much vitamin D in your bloodstream, greater than 125, but too low in the cells, 45 according to SpectraCell, how do you manage that? Well, typically I don't go off of SpectraCell for vitamin D. Again, the gold standard for vitamin D measurement is going to be a 25 hydroxy vitamin D. SpectraCell is looking at a lymphocyte stimulation test for vitamin D, so not the best. I would not base it off of your vitamin D off of SpectraCell. I would utilize just your standard 25 hydroxy vitamin D. And if you want to compare it to a 125 hydroxy vitamin D as well, look at the ratio. I think that is awesome. All right, cool. Next question. If I'm 30 years old and still have bedwetting, what could be the cause of this and how to cure it? Well, again, just to make sure we address the low-hanging fruit, making sure the timing of water before bed, 3 hours before, get the water out. Number two, adrenal dysfunction can be an issue because when your aldosterone levels are low, you tend to pee a lot more because you can't hold on to your minerals, tend to pee a lot more. So making sure there's no adrenal dysfunction. I find people that have adrenal issues, that can be an issue and can create the peeing reflex and can seriously go up. And number three, I'd say parasites. I see parasites can have effects with that as well. So it's very possible there could be an infection that could be driving that. So I would look at the parasite component, the infection component, the lifestyle component with water, making sure it's not too soon, and then the adrenals. So I would add in some extra electrolytes and minerals and get on some adrenal support based on your cortisol rhythm. Maybe your cortisol is too high or too low then. I'd be curious to know. And I would just support it according to that. Hope that helps. All right, we'll continue doing some riffing here as we go along. Let some questions build up in the queue. All right, so any other questions here? Feel free and let me know on the live chat. It's a couple things that I wanted to address while some questions are coming in. So with the adrenal stuff that we just kind of talked about earlier, your mineral corticoids are made by your adrenals, and that basically helps you hold on to minerals, right? So that hormone's called aldosterone. And when your cortisol is low, right, when your glucocorticoids are low, that's your cortisol. Typically, your mineral corticoids, that's your aldosterone, is low as well. So making sure you're getting enough potassium is really important. Making sure you're getting enough high-quality sodium. And I'll do like the Redmond's Real Salt, I think is great. I'll do the Celtic sea salt, the Himalayan sea salt. All of that can be really good just to get extra minerals in your system. So absolutely love that. All right, next, couple other things. Protein intake, big, kind of what's my general recommendations in and around protein? Typically about half your body weight in grams. So if you're 200 pounds, then 100 grams of protein is a pretty good recommendation for how much protein to have in a day. And typically we'll taper it up if you're exercising and doing a lot of resistance training as well. So CrossFit stuff, we will up it and increase it as well. So again, protein is really important because that's a really important building block for your cells, for your neurotransmitters, for your mood, for basically all of your amino acid hormones. So really, really good things. All right, we got a couple questions here on Facebook. I have high cortisol and D. fragilis. What do I treat first? Do I support the adrenals first and parasites next, or the other way around? I would always go and I would always address the adrenals first, just because people that have parasite issues tend to have fatigue or inflammation or brain fog. And those are all from the body's inability to deal with inflammation optimally. So coming at it from the perspective of stabilizing the inflammation, making sure the diet's good, really making sure the adrenals are good, that helps. Cortisol is also important for healthy gut lining, right? IgA is that important gut lining, mucosal antibody barrier. And if cortisol is too high or too low, that can affect the integrity of that gut lining. So always adrenals first for the most part. Hey, Dr. J, I had a CT that shows kidney stones in each kidney. Besides lemon and apple cider vinegar, what can I add to the diet to help it? So one of the first things I would do is I would decrease oxalates. So on my site, I have a nice oxalate handout, but you can Google it. I think the University of Pittsburgh has one online that you can get. Just type in like low oxalate diet, University of Pittsburgh. You'll see it up there. And just try to avoid all the medium to high oxalate foods. Also avoid vitamin C for the time being. You can do lemon in your water. That's very helpful, but cutting down the oxalates, increasing magnesium consumption should significantly help. Cool. Starting some apple cider vinegar, kefir, and sauerkraut. Felt great for 3 days. Now every time I take ACV before a meal, my stomach hurts. All night was really hurting bad. Have tested positive for Candida and H. pylori. So you probably have a thinner gut lining going on, right? Apple cider vinegar is acetic acid. It's got a pH of about 2.5 to 3. So it is acidic. And if your gut lining is a little bit more thin and you don't quite have good integrity at that mucosal gut lining, taking that apple cider vinegar is probably going to be irritating on the gut. So number one, you could take it in water, like put it in a glass of water and then drink that. Or number two, you can eat your meal and then take the tablespoon of apple cider vinegar. So there's food in there. So the food kind of acts like a sponge, soaks up a lot of that acetic acid, and it won't be as irritating on the gut lining. Great. I eat gluten-free, sugar-free diet and get canker sores. Is it possible to get canker sores from sour products like lime juice, etc.? Again, keyword is gluten-free. I find grains in general can drive canker sores for me. I used to almost in my mouth always had a canker sore at least at one time, right? Always a canker sore. I went from one canker sore healing to the next. And that's one of the biggest signs of gluten issues. So I would make sure you're keeping grains out of your diet altogether. I think that's a huge component to help. Okay, great. Could you get into the dawn effect of glucose and why would glucose be high just when you wake up, when you have eaten an early low carb dinner? Well, if you look at your cortisol rhythm, right? Cortisol is higher in the morning and gently drops down throughout the day. And if you look at what's called the cortisol awakening response, your cortisol starts off, let's say at 10 units of cortisol at waking, hypothetically. Let me use a good recommendation. So let's say 14 or 15 units of cortisol you're waking up with. That's going to go up 50% in the first 30 minutes of waking up. People don't realize, but waking up is actually a major stress response on the body. So if you're at 15 units of cortisol at waking, within 30 minutes, you'll be at 22 units of cortisol. And then you'll gently taper down from there. So if you look at it, I would say 80%, 75% of all your cortisol is going to be made in that first 0 to 30 minutes of waking. So because of that, relatively speaking, at nighttime, you may be at 1 to 1.5 units of cortisol versus 15 to 20 right at waking. So because of that high cortisol effect, there's what's known as the dawn phenomenon or the Somoji effect, where cortisol can increase your blood sugar. That's why the best way to look at how you're doing blood sugar wise is seeing how you're doing it, how you're responding pre and post meal. So go into a meal fasting and then do a 1 hour, 2 hour kind of gig and see if you can, get below 120 within 2 hours and ideally below 100 within 3, because that's really showing you the effect of cortisol with your food. Excuse me, back up. That's showing you the effect of glucose regarding your food intake versus glucose regarding your cortisol awakening response. So two different things, and that's why it may or may not be an issue. Do you recommend Redmond's minerals over pink Himalayan sea salt? What's the difference between both? Should you take both for adrenal issues? Again, it depends. I like the Redmond's mineral salt, one, because it's not overly high in iodine or anything, but two, it's just so soluble. If you put it in water, it really gets mixed very well, and it's just very easy to drink. And I like the taste and the flavor of it a little bit more. I find the pink Himalayan tend to be a little bit more granular and don't dissolve in water optimally. So then when you drink that water, it's like it's all kind of congealed at the bottom. So I like the Redmonds better. Both are great sources though. And if you can find a Himalayan that's more, not as granulated, more broken down and fine, that could be a great option. Are IgG food intolerance tests reliable? I would say no with the IgG. Again, if you come back with IgG tests that show a high amount of antibodies for a certain food, I think it's fine to remove that. I'm more concerned about the false negatives, certain foods saying, they're okay, but they're not. And then if, let's say it says strawberries have a significant issue, well, you're probably going to now eat more blueberries and more raspberries. So then now are you going to have an issue with raspberries and strawberries now and not blueberries? So I'm not a huge fan of that. There are other tests out there that will look at IgG or IgA, or that you have some from ELISA ACT, which will look at T-cell interaction as well. So there are other labs, I think, that are a little bit better, that will be a little bit more specific. Not a huge fan of food allergy testing. I find people come back with okay for grains and dairy, yet they know they have responses to some of those foods. I'm not a huge fan of it. If I'm trying to leverage people to make changes, I will utilize them. Or if I'm dealing with parents and they have kids that aren't willing to do it, then we'll utilize them, or just people that want to see it, we'll do them as well, but not a huge staple in my practice. Husband has a cyst on my adrenal gland, has anxiety and depression through the roof. He also has horrible cramps. He is at a healthy weight. He is at a healthy weight, very active. We are clueless. So again, I would want to know what's driving the cyst on the adrenal glands. Typically, cysts are going to come from inflammation. So in the female analogy, ovarian cysts typically happen from increased insulin that drives androgen imbalances in females. So with men, insulin tends to be a component, right? Insulin and estrogen levels tend to be a component. So I would look at getting fasting insulin and total estrogens looked at. There's probably a hormonal imbalance there. Again, how you fix it will be the same. You need to get the insulin down. You need to get detoxification pathways going. You need to get an anti-inflammatory kind of paleo template diet going off the bat. How much liquid minerals do you add to your glass of purified water? I mean, I'll typically just, I did some here now. I did some real salt minerals, and I just gently cover the bottom layer of my glass. So when I drink it, I have some good minerals here. Yeah, a little salty. I put my water, make it a little more salty. I love the minerals. I feel better with it. It quenches my thirst better. If not, I'll do one by Trace Mineral Research called Endure, and I'll just do a couple of drops in it, typically like 16 to 20 drops. Pretty simple. What's the matter with iodine? I thought it was good for your IQ and to clean radiation. Yeah, iodine's great, but there's some studies with iodine salt or iodinized salt increasing Hashimoto's. So if you're going to use iodine, I like it to be in a fashion where you're measuring it. You know exactly what you're taking. It's a very punctuated fashion. You're not letting it drip in all the time with the salt that you're taking, just because there's some research with more iodized salt in intake and Hashimoto's. So because of that, I like to be a little bit more specific in how it's added. I like to know exactly how much I am doing. So if I'm doing iodine, I know, hey, it's 150 micrograms per drop, and it's not going to be salt happening liberally throughout the day. It's going to happen in a very punctuated form. I have a lot more stress and anxiety recently. I have high levels of reverse T3 and low levels of free T3 for years. I also have some infections and possible Lyme. What would you suggest to lower reverse T3? Well, of course, anytime we see high amounts of reverse T3 are basically metabolic blanks in our gun, so to speak, right? So we had a gun, we have the cartridge, and we have bullets in the cartridge. Imagine taking the bullets out, we put blanks in, right? So the blanks, you pull the trigger, right? You hear a noise, no bullet comes out. The difference is that the blanks, they take up space from the real bullets. So the reverse T3 are like the blanks. They prevent the real T3 from binding into that receptor site and having a metabolic effect. So the reverse T3, I like it, is basically likened to adrenal dysfunction, because the adrenals tend to be upregulating a cortisol imbalance that's happening, maybe some HPA axis dysfunction with the brain and the adrenals because of that stress response, feedback loop being disrupted, and the body is trying to down-regulate the thyroid, turn it down, and it's doing it by putting metabolic blanks in the receptor site. So get the adrenals fixed. And then typically the liver is important to look at too, because the liver is a big important site for thyroid conversion. But the adrenals and of course the diet's super important. So you have a lot more anxiety. So got that one done. How can I tell if I have too low or too high of cortisol? I know I have adrenal dysfunction because I have chronic pain and fatigue. You got to get a cortisol rhythm test. Do it with a cortisol awakening response as well. That's great. Would having water from copper utensils be a good way to get copper intake? Well, too much copper prevent zinc uptake. Yeah, I wouldn't try to get copper that way personally. If you look at copper foods, a lot of the high copper foods are going to also be the high zinc foods as well. So seafood, nuts, veggies, they're going to be the best sources of copper as well as zinc. So as long as you're doing it together and you're getting a good ratio, you should be fine. See, on the GI effects, I have a 4 Hafna alveoli growth. Have you seen this type of bacteria? It's something to worry about. No, I don't typically see that bacteria. I'm not a big fan of the GI effects. It doesn't pick up infections well. It'll look at a lot of bacteria, a lot of commensal bacteria that's kind of normally there, but maybe out of balance. Not a huge fan of that test. I wouldn't worry about that type of bacterial overgrowth. I'd be much more worried about other infections that may have been missed. What's your thought on soul water? Not sure what that is. If you can give me a little bit more info. Is that reverse osmosis? Is that mineral infused? Is that some kind of pH type of water? If you can give me some more info, that'd be helpful. Doc prescribed me diflucan for Candida, but it's going to be over $300 even with insurance. Should I try an alternative or bite the bullet and get diflucan? I would personally be doing the herbs first. I would be doing the oil of oregano, berberines. I'd be hitting that up first. It tends to be a lot better, better suited, has a long line of being more selective towards the bad critters and supporting the good stuff. In my line, we typically use GI Clear 5 and 6 on the Candida side, right? 75% carbachol extract. That's the active extract and oil of oregano. The GI Clear 6 has podiarco in it too, which is really powerful at knocking down Candida. But again, you want to make sure the fungal issue is not driven by an upstream infection like H. pylori or a parasite infection. And also make sure the diet's dialed in. Little clinical pearl here is when you're doing some Candida killing, take a little, try to up your carb intake just enough so you can feed the bugs. That way they don't go into a hibernation or spore or cyst-like state. So it's kind of like you go shark diving, you chum the water so you can get the sharks to come out. It's kind of the same thing when you're dealing with the Candida. That way the herbs can knock them out. See how to know if retesting adrenal with the, how to know if retesting the adrenal 201H CAR is necessary. I was stage 3 adrenal dysfunction 2 years ago and still fatigued now after 8 hours of sleep. So typically I don't retest on the adrenal side if people feel significantly better. If people aren't feeling better, usually within 6 months, we retest. And I never retest someone that's not infection-free. Because if they're infection-free, well, sorry, so if they have an infection, if they're not infection-free, why do we want to retest them? Because their adrenals are going to be having to upregulate, right, because of the infection that's present. So if they're having to upregulate, that's a stressor that's then it's going to chronically be there, and that can throw off the adrenals. That can put stress on the sex hormones. That can put stress on the cortisol. So I would never retest adrenals until I'm confident that someone's infection-free. And if symptoms are still lingering and they're infection-free, then I'd want to look at it. I'd also want to look at an organic acid test to see how the mitochondria is doing if they're still tired, and also look at the thyroid too. That'd be important. Any natural supplements for a quick response instead of Viagra or Levitra? So regarding that, yeah, there are some things that you can do. There's a product by, what's the company? Novus Optimum, and the product is called Pleasure Enhancer. That's a really good product for increasing libido and just kind of having a natural Viagra effect. That one's been good. I've used it for a while. My partner has high D-arabinitol on an organic acid test, but only 1+ on Candida / yeast on GFX. What does that mean? Again, D-arabinitol on the organics, that's more of a systemic marker for Candida, right? D-arabinitol is in the urine, so it's kind of a marker that the Candida is more of a systemic issue. Again, the gut test is only going to look at Candida in the gut. So again, the fact that you have Candida systemically is definitely a bigger concern because, you know, it's in the gut, but it's also moving throughout the body. So it means it's more of a systemic issue regarding the fungus. See here, does Ritalin cause adrenal exhaustion? So Ritalin and adrenal exhaustion. So that's a great question. So Ritalin, I'd have to look at the mechanism of action on it. I'm going to Google that right now. I'm not sure if that's a methamphetamine like Adderall. If it is, a methamphetamine will be a significant, yes, it's a methylphenidate. So it is a nervous system stimulant. Yes, absolutely. So Ritalin, basically how it works is it stimulates your nervous system so much where it actually calms it down so then it can focus. So it overexcites it so much to the point where it becomes incredibly hyper-focused. All right. So that's the issue with that. And Ritalin can definitely drive adrenal issues for sure because it's methylphenidate. It's an adrenal central nervous system stimulant. What's the major driver of the central nervous system regarding stimulation? It's going to be adrenaline, right? Adrenaline's the same thing as catecholamines, right? You have noradrenaline, adrenaline, you have epinephrine, you have norepinephrine, you have catecholamines. They're all the exact same thing, by the way. And that typically will drive cortisol. So the adrenals will be severely whipped by the Ritalin for sure. What do you think about ozonated water for drinking and cooking with? I mean, ozonated water, it's just 3 oxygen molecules. They come in there. They're powerful antimicrobial. They kill things. I think it's great. More for a swimming pool. I don't think you have to do it for drinking water. I think a really good reverse osmosis and or a carbon-based filter combined will be better. Ozonated, I think, is better for like swimming pools and such. There's some that do a combo ozone filter and salt water. I love those for the swimming pools. What's the best way to get rid of yeast or Candida naturally? Of course, the diet stuff. Make sure there's not an upstream parasite or H. pylori infection because sometimes that can be more of a downstream symptom of an upstream problem. So diet, lifestyle components, and then get the right herbs to knock out the infection and knock out the Candida, right? My line, I always use GI Clear 5 and 6. Again, make sure the other infections are addressed too. All right, great. Your thoughts on Maca? Huge fan of Maca. I think it's great. Not all Maca is created equal. If you look in my online store, I'm a big fan of the feminescence type of Maca. I characterize them for cycling and menopausal females. I love that. It helps with mood. It helps with PMS. And it also can be very helpful for menopausal females that have hot flash issues and mood issues. There are different phenotypes that we use for different types of women. But if you look in my online store, I carry one called Feminescence, and there's a Maca Pure and a Pro. I categorize them as cycling and menopause. So if you're cycling, obviously cycling. If you're kind of in that hot flash menopausal realm, of course, menopause is the better one. I do like it though. The reason why I like the one on my site is because it's an individual blister pack, so it prevents Maca from oxidizing because it's heavily oxidized. And there's a lot of studies on that one specifically, and I've had some really good clinical outcomes with it, so I'm a big fan of it. What's your opinion on nutritional yeast for getting your B vitamins? I think your nutritional yeast can be really good. My only issue with nutritional yeast is, will it drive more of a yeast issue with that person? That's the only question I kind of have. Again, if you look at the biggest source of B vitamins, it's going to be meat. So I'm a huge fan of just getting your B vitamins from meat. That's going to be the best. But a lot of supplement companies are going to be using high quality yeast. If it's a really good quality yeast, right? Really good quality yeast culture, and they're using beneficial yeast cultures, then I think that's okay. I'm from the UK. I've heard good news about MSM/sulfur. What are your thoughts what's your thoughts on this as a daily supplement? I think MSM, that's methyl sulfonyl-methionine, and sulfur. I think sulfur amino acids are great. I think if you want to add those to your regime, that's awesome. I don't see a problem with that. I'm going to grab some of my sulfur real quick. Hold on. I'm going to just grab some sulfur aminos here right now. But I think sulfur is great. It really pushes detoxification really well. They're precursors to glutathione, which is great. MSM is great for joint issues. So I don't have a problem with that. I don't think it may have to be something that's in there all the time unless you're having a lot of joint issues or detox issues. But I think it's something good to kind of rotate in there for sure. What causes black feces plus extensive weight loss plus moodiness? Well, if it's really black, I mean, it could be from charcoal, from taking charcoal. That's number one. I'd always want to be careful of there being a little bit of blood in the stool. So I would really make sure there's no blood in the stool, make sure there's no ulcerations, those kind of things. May want to get a stool test, make sure there's no infections driving it, and just rule out the low-hanging fruit of just being charcoal. For low Firmicutes bacteroides ratio, do you recommend probiotics? I see the VSL3 has a lot of Firmicutes. Do you recommend a certain one? So Firmicutes bacteroides ratio, you want more of the bacteroides in relation to Firmicutes. So you want a lower ratio, right? If Firmicutes goes up and bacteroides is down, you have a higher Firmicutes bacteroides ratio. If Firmicutes is lower and bacteroides is higher, then you have a lower ratio because they're more equal, right? So yeah, I would really make sure there's no infections driving it, right? Make sure there's no dysbiosis or infections driving it. If there are no infections driving it and your diet's good and you're eating some fibers that may help feed it, if you can tolerate a little bit of legumes, some beans, if your gut issues are good, that may be helpful fiber. If not, some of the unripened plantain flour or banana flour can feed some of that good flora as well. And then, of course, the probiotics as well. A certain probiotic, I'm a big fan of the ProBioFlora that's in my line. I like it because it's dairy-free, number one. And number two, it has something in it called phage or phages, which have antibacterial effects. So if there's a commensal overgrowth like E. coli or bacteroides or enterococcus, it can kind of knock some of that down, and it boosts up some of the probiotics. And it's in a non-dairy culture. So if there's any dairy sensitivity issues, you're going to be good. What's the GABA spray that you've used over the past couple of live Q&As? Is it helpful? Great question. Well, that is actually a secret. Now, it's by Quicksilver Labs. Quicksilver has some really good liposomal products. I like their glutathione. I like their GABA. I think GABA is great when you're stressed. It really helps you relax. If you're feeling like you want like a shot of alcohol or you want something like, a Xanax to chill out, that's where the GABA is the better option in that situation because it's an actual nutrient. And that product comes with L-theanine too, which can be really relaxing as well. All right. See, okay, great. Let me just keep on addressing all these issues. I have low firmicutes and high bacteroides. Okay, that's good. That's a good sign. What are your thoughts on NADH? Yeah, NADH is nicotinamide, something, something, something. It's basically it's a reducing agent in the Krebs cycle, if I remember biochemistry correctly. So you have 3 NADH per 1 FADH2 when the Krebs cycle goes around, and it basically grabs up hydrogens, right, which is an electron. So when you increase electrons, that's called a reduction. So it's a reducing agent. It grabs onto electrons, and then it dumps those electrons from the Krebs cycle into the electron transport chain, where then it combines with CoQ10 or ubiquinone, and it generates ATP. So 33 ATPs per 2 cycles around the Krebs cycle. I'm sorry, yeah, 30, no, I think it's 33. And then it dumps all those H's, hydrogens, into the electron transport chain, where it generates, I think, totally 36 ATPs from glycolysis to Krebs cycle to electron transport chain. So NADH is powerful. You can take some of these compounds as well to help it. I think it's okay. In my line, I use something called Mitosynergy that has a lot of the compounds that help the Krebs cycle run. I'm trying to grab it here. It's on my desk. And those are going to be a lot of the Krebs cycle intermediaries, like malic acid, like succinate, like fumarate, carnitine, D-ribose, creatine, and a lot of the B vitamins and some of the antioxidants like curcumin and resveratrol. So I do it that way. There are some NADH compounds that are out there. I know Life Extensions promotes one, and I think it could be helpful, but I'm a huge fan of the one that I formulated though. What's for lunch today? That's a great question. My wife's off of work because we're having a baby in a month. So we let her take off the last 5 or 6 weeks. We made a decision to do that for keeping stress down. So she's cooking some good kielbasa and maybe some sauerkraut today. So I'll get what she's having, which will be great. Is it safe to take GABA supplements every day? I don't see it being a problem. It's an amino acid. Just make sure the quality of the products that you're taking is good. Can you share your website link? Absolutely. So if you're looking for some of the things that I mentioned, justinhealth.com/shop. And I'll put it in the chat window here too, so you guys can see that. And any of the things I mentioned there, feel free and go there to acquire that if you need. What's the best test do you find for Lyme? I have 2 bands of the Western blot, but not sure how to treat. So if you have 2 bands, I'm guessing that's an IgG band you're talking about. Typically, you need 5 for the CDC to be considered positive, or 3 for the alternative criteria. The gold standard in Western blot's going to be a lab out of Palo Alto, California, called IGeneX. They're really good. I use one called MDL, Medical Diagnostic Laboratories, out of New Jersey. They're a little bit more affordable, and I think Lyme's important, but I think it's overdiagnosed. I think a lot of people that have immune compromisation, their immune system's compromised, they tend to have issues with just having Lyme antibodies to begin with. So the question is the Lyme the issue directly? Did the Lyme cause the problem, or is the Lyme more of an artifact of the immune system being more compromised? When we see people that have gut infections and adrenal dysfunction, they tend to be their immune system tends to be more susceptible to cytomegalovirus, to Epstein-Barr, to other various herpes viruses, to other infections. So the question for me is it the chicken or the egg? And my thing is, I'm trying to get to the cause. And in some people, I'd say in a lot of people, I feel like Lyme is more of an effect of a compromised immune system and not the cause. I see too many people that have very poor diets, that have a lot of gut dysfunction, a lot of infection, very poor detoxification pathways, and they have Lyme. And then these doctors are just so hyper focused on the Lyme, they're not getting to the other foundational issues. And then the problem is, a lot of them, if they're more aggressive, if they're like an ILAD stock, they're hitting them with a lot of antibiotics, and they're doing it for a long time. And that really, I find, that can screw up the gut microbiome and create more symptoms. But then the problem is, because there's a closed loop philosophy when talking about Lyme, right? Those more symptoms are you're having die-off, and the die-off's always the symptom. And then that's what we just talk about forever. And the person's in this closed loop of more antibiotics, more die-off. Don't worry. It's not that the antibiotic causing a problem. It's just the die-off. And that, I think, sets a lot of Lyme patients up for a lot of long-term issues. I'm not saying patients don't have primary Lyme issues. I just find Lyme is more as a part of a bigger problem most of the time. And the Lyme may not have to be addressed directly. It may be, the other stuff may be able to be addressed, and the Lyme will kind of take care of itself because the other infections are holding back the immune system. Hope that makes sense there. Is it good to take pure vitamin C per day? I think doing a gram or two of vitamin D per day is great. What's your thoughts on yantra mats? It's really healthy having plastic spikes against your skin. I think Dave Asprey has one of those products and one of his mats. I think there's some good things about it. I think what happens is the mats just are hitting a lot of your basically acupuncture meridian points and potentially having some relaxation effect because of it. So I've heard some good things about it. So I think if it works for you, that's great. Can adding L-theanine help my ADD 14-year-old daughter? If so, 150 micrograms be a good place to start. Yeah, I think L-theanine is great. Even more important is dopamine, right? Is L-tyrosine, because typically people that have ADD, they tend to not have enough dopamine, not enough adrenaline to drive that focus. So I would look more at the adrenals and the dopamine pathways, but I think adding in some serotonin and GABA support is still great. Let's see here. Can you help me? Can you please help me about H. pylori bacteria causing a blockage, final stage, more than 8 years? If there's a blockage, solution, what type of surgery? Thank you. Again, I'm not sure what you're talking about with blockage, or were you talking about a blockage in the stomach to the small intestine to the large intestine? But I would fix whatever infection is there and make sure it's addressed. I'd make sure you get the inflammation down. And if there's some kind of scar tissue there, I would look at trying to use systemic-based enzymes to help clear out the scar tissue. And see if you can kind of clear out the scar tissue with the enzymes versus the surgery. All right. How to increase libido in your significant other? Well, number one, decrease cortisol, decrease stress. If that's an issue, adaptogens are a really good place. Maca is a really good place to help with females. If you're cycling, then feminescent cycling is great. And then there's also some herbs that can be used as well for kind of aphrodisiacs. Horny goatweed's one of those that's really good. And again, that pleasure enhancing product I mentioned earlier by Novus Optimum is a good one too. What can cause severe constipation when all doctors' tests show nothing is wrong? They said it's normal aging. Nonsense. There's probably some kind of bacterial overgrowth or some kind of infection going on. You probably also have low stomach acid, low enzyme production. So I would look there first. We've done lots of podcasts on this. So go back to the basics. Good food, chewing it up well, stress-free environment, hydrating away from food, right? Making the food more anti-inflammatory, right? A paleo template, getting the enzymes and HCl started first, and then looking deeper for infections later. I have high protein in my blood. Does this mean I need HCl and digestive enzymes? Again, if you're having high protein in your blood, there's probably some type of breakdown happening, right? That could happen from like extreme CrossFit. You get a lot of rhabdomyolysis, which happens from extreme breakdown. Those breakdown of protein go to the kidneys and really can gunk that up. So I would look at the extreme exercise or extreme catabolic physiology. What's driving that? Maybe exercise. I have very low adrenal mandylate. That's a marker for adrenaline. And homovanylate's the marker for dopamine. I'm generally very high strung, anxious. What does this mean? Yeah, so you've depleted a lot of your adrenaline pathways. So you need to get your adrenals supported. You need to get your catecholamine pathways supported with tyrosine and serotonin, 5-HTP and B6 and B vitamins, and get your adrenals supported and fix whatever is driving the poor stress, whether it's work or poor sleep or poor diet. Get all that fixed. What would be the best supplement to take for recovery for endurance athletes? So running, I would say branched chain amino acids would be one of the best things that you could do there, Matt. That would give you instantaneous fuel for the muscles. And again, it would prevent your body from breaking down other amino acids for fuel. I would also look at creatine. I mean, again, creatine may not be as good because creatine's a more like punctuated high intensity. But I think it'd be worth adding it in because it can help with growth hormone. And I'd also look at ribose. Ribose would be excellent because ribose is going to help the mitochondria function better. And even carnitine, because a lot of the distance running is going to be more fat burning based. So the carnitine would help with that. All right. That would help utilize fat metabolism for energy. Hope that helps, guys. I got a patient here I got to run to, and look forward to chatting again soon. Facebook, we will talk later. Done there. And you two will talk later. Thanks a lot, guys, for tuning in. I'll be here next Friday. Same bat time, same bat place. Take care, guys. Bye.